afternoon. My name is Amanda Standifer, and I want to talk to you about opioid use disorder here in Arkansas and how it affects our state. So there's a few objectives I want to address. First, I want to summarize what opioid abuse disorder is doing to our state. I want to state the overall intervention goal that we will describe. I want to discuss objectives, outcomes, and activities related to this goal, and describe the key message and intended audiences. So opioids and opiates are groups of drugs that function by activating the opioid receptors to block signals that indicate pain. This can also lead to a sense of euphoria, which is just an intense feeling of pleasure. These substances can be synthetic or natural. If they're a natural opiate, they originate from the poppy plant and include examples such as morphine, which is used for pain, codeine, which is used for pain and cough suppression, heroin, and opium. If they're a synthetic opiate, they're called an opioid. These are substances generated to mimic the effects on the body that opiates create and include examples like the pain medications fentanyl, oxycodone, methadone, and an anti-diarrheal medication, loperamide. Opioids and opiates either can be taken orally, they can be injected, they can be inhaled, or they can be used topically. So regardless of the reason for starting to utilize opioids, the addictive nature of these substances is reflected in individuals experiencing opioid dependence. Opioid use disorder is a chronic condition diagnosed when individuals need to frequently increase their dosing to maintain pain control and reach those euphoric states, or they continue to utilize these substances even though the side effects negatively affect their daily lives. Adverse outcomes from opioid use disorder can affect both health and social impacts, and those frequent cravings, drug-seeking behaviors, and erratic behaviors and those long-term changes to the brain chemistry make maintaining employment difficult. These can lead to a decreased socioeconomic status and homelessness. These behaviors can also lead to a loss of family support and connections. Adverse health effects include risk for infection, such as HIV or hepatitis C, from IV or injection drug use. Endocarditis is another possible infection. This is inflammation of the lining of the heart and valves. It is an infection that's commonly caused by injectable drug use, and it's often fatal. In the U.S., opioids are responsible for approximately 2 of every 3 deaths attributed to overdose. These deaths are primarily from depression of the respiratory drive. This problem is not new, but it is a problem that is growing. There were 362 Arkansans in 2019 and 457 in 2022 who died from an overdose, with an opiate or opioid being attributed as the cause in most of these deaths. This year, from January to March, 87 drug overdose deaths have been reported, with heroin, hydrocodone, fentanyl, and morphine being the substance causing those deaths. This condition afflicts Arkansas residents regardless of age, culture, gender, or socioeconomic class. Since these drugs do cross the placental membrane, infants from mothers dealing with addiction can be affected. The genetic predilection to dependency is a contributing factor, but so is seeking treatment for something as minor as diarrhea or a cough, or as significant as recovery from a medical procedure or surgery, since these are all instances where opioids may be prescribed. While legal measures to monitor and track the opioid prescriptions dispensed by practicing physicians is monitored closely, this is not enough to hinder prescription writing and encourage non-narcotic attempts to manage pain. Arkansas is currently second in the nation regarding narcotic prescribing. On average, physicians write 75 opioid prescriptions for every 100 people who seek treatment. 75% of Arkansans who said they had an opioid addiction reported that their initial exposure was from their physician's prescription. If solutions are not devised, these numbers will continue to climb. From 2019 to 2021, fentanyl overdose deaths climbed by 251%. We must include these healthcare personnel who provide care for these patients with pain as key partners and stakeholders. We also need to include personnel who work within social service agencies so they can advocate for non-opioid pain management options or advocate for treatment options for dependents. One solution for this will be to increase access to measures to prevent death due to opioid abuse disorder and overdose in Arkansas. This is my intervention goal for this presentation. In addition to providing this education about signs and symptoms of overdose and opioid use disorder, these measures include increasing access to Narcan. Narcan reverses the respiratory failure that leads to death in an overdose, and increasing these accesses to these fentanyl test strips are so that the individuals can test their substances for fentanyl, which attributed to 863 Arkansas families losing an immediate family member. So some objectives to meet this goal include the following. By May 31st, 2024, some of our stakeholders and partners, our county health agents, will disseminate some knowledge regarding opioid use disorder, including signs and symptoms of withdrawal, overdose, chronic effects of the use, methods or resources to stop the misuse of opioids, and the availability timeline instructions for use on the vending machines that I'm going to explain in a second to each of the 75 counties in Arkansas. This campaign will include a statewide anonymous response survey that will be given between May 31st, 2024 and July 31st, 2024. So many states are placing vending machines that are funded through grant programs that provide free Narcan kits, as well as free fentanyl test strips, which are small paper strips that detect the presence of fentanyl in many different substances, including heroin, cocaine, marijuana, or methamphetamines. Arkansas has yet to join this initiative. So my second objective for this is by July 2024, these vending machines that dispense these free Narcan and fentanyl test strips will be placed in the vestibules or entryways of each of Arkansas's 3 Veteran Administration hospitals. I chose to start with the veteran facilities because research has shown that military veterans are twice as likely to die from opioid overdose than non-veterans. So my third objective is by December 2024, vending machines that dispense these free Narcan and fentanyl test strips will be placed in the vestibules of the 13 visitor center rest areas in Arkansas. So part of what makes these vending machines popular is the anonymity that's provided. They don't collect any personal information from the user. So by placing these machines in the entryway into these rest areas with visitor centers, there is staff on hand to deter abuse of the machine, but it does still foster that anonymous nature, as some users may not want to be seen at their doctor's office assessing these resources due to fear of criticism from their healthcare provider. So my fourth objective for this is by December 2025, I want to expand this program and have vending machines that dispense these free Narcan and fentanyl test strips placed in the vestibules of each of our 20 prisons that the Arkansas Department of Corrections maintains and 25 of our 75 counties, placing preference on the jails that are in counties with an age-adjusted overdose death rate greater than 31 per 100,000. As the vestibules in jails and prisons are typically open to the public anytime, day or night, 24/7, these locations are easily accessible and critically important to combat this epidemic, as overdose rates once released from incarceration are 129 times higher than that of the standard public. So some hopeful outcomes of these objectives include some short-term, some intermediate-term, and some long-term goals. So my short-term goal is by July 31st, 2024, 60% of the respondents to the survey that we spread will report being aware of the dangers of opioid use, and 50% of the respondents will report understanding on how to access and utilize the vending machines, hopefully an understanding of the anonymous nature of these machines, and they will be able to access these free Narcan and fentanyl test strips. An intermediate goal, by December 31st of 2024, 100% of the Veterans Administration hospitals and visitor centers, rest areas, will provide free access to Narcan and test strips that detect fentanyl. One of my long-term goals includes the date for December 31st, 2025. By this date, I would like to have 100% of our Arkansas-run prisons and our top 25 counties with the highest age-adjusted overdose death rate to have these vending machines up and running, functional, and providing free access to Narcan and fentanyl test strips to prevent these overdose deaths. My overall overreaching long-term goal is by increasing access to these life-saving measures, I'm hoping that reports of opioid overdose deaths in the state of Arkansas will decrease annually by 10%, my annual mark being each year that these vending machines are functioning and being restocked and utilized. So part of implementing this, we need to think about our inputs. So primarily, we've got to find a funding source. This is critical to getting this program started. There are grants available. Numerous states have used them, and they will fund these initial machines. Key partners and stakeholders like our local business owners, which can include our pharmacies, it can include bars, places where they're likely to experience overdoses in the facility, maybe some of our marijuana vendors, some faith-based organizations, large corporations, and healthcare personnel may consider donating or sponsoring this initiative once it proves successful. This program will take the help from many different organizations. It will require collaboration from public health personnel, healthcare providers, law enforcement personnel, and government officials to ensure proper placement of these machines, collect the data required to determine the county jails best suited for placement, and evaluate the effectiveness of increasing access to these life-saving measures. The education and dissemination of knowledge on opioid abuse and overdose will begin before the placement of the first machines to better the chances that when the machines do become active, the residents can find it and utilize these resources. The survey dispensed with the education will also aid in gauging the receptiveness of the public to these resources and attempting to persuade individuals to use them. These activities will lead to increased access to Narcan and test strips along with the knowledge of how to use them and how to save a life. So our key message for our primary audience has a couple of overreaching goals. So communication efforts are in an attempt to do three things for this plan. We're trying to inform, so we want to educate Arkansans about the risk and dangers of opioid use, the signs and symptoms of opioid use disorder, and the availability and use of Narcan to reverse respiratory arrest associated with opioid overdose. We want to engage. We're trying to engage the community, which includes our patients, their families, healthcare providers, and government officials so that we can advocate, or they can advocate, for decreases in opioid prescribing, increases in policies that regulate opioid prescribing, and maintaining awareness of the availability of these resources. We also want to persuade. We're trying to encourage the use of the available vending machines to receive these free opioid overdose preventative measures to keep on hand in case of emergencies. We want to encourage and support Arkansans who are experiencing opioid use disorder to seek treatment to quit safely. So our primary audience are going to be those Arkansas residents who have or are at risk for chronic opioid use. Our key message is going to be that opioid use disorder includes the desire to obtain and use opioids, including fentanyl, oxycodone, morphine, and heroin. And this can lead to the inability to maintain relationships, employment, and stable housing, as well as chronic health conditions, comatose states, respiratory arrest, and death. To achieve this, our communication channels we can use social media tools. We can use mixed media that are print media, so we can have flyers, we can have posters, we can utilize infographics, we can access newspapers, we can use digital media, which includes radio communications, television. We can utilize the internet, so we can access digital newspapers to run ads. We can utilize ads on the internet itself. We can have a website set up so that anybody can search and find this information, or we can do this in person. This would involve setting up a booth, having some kind of an information session, or just utilizing word-of-mouth communication to spread this information to people visiting future vending machine sites. This can include going out and talking at homeless shelters, talking to the physicians so they can make sure to spread this information, or go to large public gatherings and just network. Our secondary audience is going to be the family members and loved ones of these Arkansas residents who are experiencing or struggling with opioid use. So our primary message to them is going to be that addiction to opioids is a complex condition that causes a compulsion to utilize these substances despite the often harmful or devastating consequences. Family therapy, counseling, and support can aid in improving the effectiveness of treatments and long-term compliance with abstinence. In order to disseminate this message, we could also use social media tools. So this can include setting up flyers on social media, doing ads, just posting and keeping it in the forefront on people's social media. We can utilize the online resources such as newspapers. We can use digital media. We can use radio, television, and we can use the internet, which again includes access to these digital newspaper ads. So the model used to develop this plan was the trans-theoretical model. So people struggling with opioid use disorder can be at any of the stages within the trans-theoretical model at any time, and they often cycle through these repeatedly. I've got the stages listed, I'm fixing to explain each one, but they can cycle in, re-enter, exit, or come back into this at any point. They are not always going to start at pre-contemplation or not always going to start at action. There may be something that triggers them to jump to action. And so these stages include pre-contemplation, which is when they're going to deny or is really just unaware that there is an addiction problem. The next stage is contemplation, which is beginning to realize a problem exists, but they don't really want to address or change it. Preparation, which they are ready to make a change. Action, they've already made those changes and they intend to continue with those changes. Maintenance, they haven't had any drug use for greater than 6 months. Their coping mechanisms are working. And termination, that is a firm belief that the coping mechanisms they have in place have permanently prevented relapse. Support for these individuals can help guide them through these changes, and this model is what was used to develop this intervention. At any point of this model, the provided education can ground the affected party, back into their desire to quit, or keep attempting to persuade them to quit through informing and engaging them. Preventing death from an overdose may be the trigger that they need to seek help to break the addiction cycle. So just to review what we talked about, I went through and I explained opioid use disorder and how it affects Arkansas. We talked about the overall intervention goal that was developed. We described some objectives. We talked about the outcomes and the activities related to the overall intervention goal, and we discussed the key messages and intended audiences. So I have my resources. There's, I think, 3 pages. So we've got the first page here, second page, and last page. And thank you very much.